Welcome to another edition in the Visionaries Community Profile Series, developed to share unique stories for eye care professionals, industry experts, and key opinion leaders in this community. With the increased amount of research being conducted linking eye health in the foods we eat, we talked to Dr. Laurie Capogna, co-author of EYEFOODS, a food plan for healthy eyes. Dr. Capogna shares in her research, her book, and offers us some simple and effective solutions to keep our patients' eyes healthy.
How did you first link foods and eye care and vision health?
Well, I've been practicing, I'm an optometrist, and I've been practicing with an ophthalmologist in a medical practice for over 10 years. And I've seen so many patients with macular degeneration and vision loss, and have been recommending, as we do, that they start taking supplements and vitamins. And I was always curious as to, how much of nutrition can they really receive from foods? If they really tried, how much of these nutrients could they receive from their foods? And if they started earlier than when the disease presented, would it make a difference and would it make an effect? That led actually ultimately to EYEFOODS and to do research on to see how much each of these foods contained of the nutrients.
Was this something you studied when you were doing your education and schooling?
Actually, I've always just had a passion about nutrition and food. My schooling is optometry with, I didn't really do any extra nutrition during optometry school, any nutrition studies. That all came after the fact when I was practicing.
Could you explain how you came up with the concept for the book EYEFOODS?
Well, once I started researching and seeing all these links between nutrition and the prevention of ocular disease, I started talking to my patients about it. And what I quickly realized is that patients don't need general information. They needed a plan. And that led me, along with my co-author, Dr. Barbara Pelchier, to then author and publish EYEFOODS, a food plan for healthy eyes, which provides a clear plan for people on what they need to eat and what lifestyle factors they need to adopt to maintain healthy eyes.
You wrote this in 2011. How much has the whole plan evolved during the time of your first published edition and to the present time?
The EYEFOODS plan has evolved a bit, but the core principles of it are actually very much the same. We need to get the lutein, the zeaxanthin, the omega-3s, the vitamin C in our diet, and the foods are very similar, the foods that we're recommending from the beginning to now. We've obviously made some adjustments to it as the science evolves. And also, we've made some recommendations to people that follow more specific diets. So people that may be following a paleo diet or a plant-based diet, people that are on vegan diets and gluten-free diets, we have recommendations for them as well.
When you started to have your patients perhaps follow the program with EYEFOODS, how quickly did they start to feel a difference? How quickly did you see a difference when you examined them?
Well, people are going to feel a difference right away because when you follow the EYEFOODS plan, you're eating more of the good stuff and, less of the bad stuff. So you're going to definitely feel better with more fruits and vegetables and fish in your diet. Seeing a difference in their ocular health, that's hard to say because it's all about prevention. So, over the years, what our goal is that we're going to see less and less ocular disease, macular degeneration, dry eye developing.
And how does this affect children?
So the goal is to get younger kids to follow these principles and to eat EYEFOODS starting young so they can have good habits, so they can nourish their eyes with the proper nutrients that they need to function. They're going to be adopting healthier habits, getting better nutrients into their bodies, into their eyes with less of the bad stuff. So the sooner we can get them started, then the healthier their eyes are going to be long term.
Are you seeing an evolution now after many years of having the plan available to your patients?
Oh, for sure. What's been happening is the patients are more educated. So the main goal with the iFoods plan is to have people aware and educated that there's something that they can do to maintain their eye health. And I'm seeing that their awareness is going up so that they're taking better care of themselves, taking better care of their eyes, whether they need to take a supplement as well, they're more aware of all of that. And with the awareness, they're following up with their appointments and they're maintaining better health and having less progression of ocular disease.
What has been the greatest challenge in conveying this information to your patients?
The greatest challenge in getting the information across on a day-to-day basis is the time. So in a busy practice, it's how do you find that time to talk about prevention to our patients. That's where the tools like the book and the website and the videos are very helpful.
How could someone find more information about iFoods and information maybe to ask you a question?
Everything's on our website, which is www.eyefoods.com. Links to some recipes, links to how to purchase the book. We also are very active on social media, Facebook and Twitter and Instagram, and there's great posts that practices can share. They're all educational posts that are meant for the general public, and our YouTube page is on there as well. And if anybody would love to contact me, I love to share information about nutrition. They can email me at laurie@eyefoods.com.
Thank you for listening to this edition of the Visionaries Community Profile Series. For more information or to join our community, visit visionariescommunity.com.